friends, so today we'll be talking about what are the important points or what are the important messages for those patients who have got a recent pacemaker implanted. So there are 5-6 points which they need to remember, the patients who have been implanted with a pacemaker or who have undergone a pacemaker surgery. So first thing is the mobility of hands. Usually the pacemakers are implanted either on below the left collarbone or the right collarbone. So whichever side the pacemaker is implanted, one should avoid excessive movements of that shoulder. Suppose if the device is implanted here, one should avoid moving the hands above the shoulder height for initial 15 to 20 days post procedure. After 1 month of completing the procedure, this shoulder mobility can be returned back to normal and patient can perform all the activities as desired. Number 2 is regarding the wound care of the pacemaker implant site. So majority of our patients who are discharged from a pacemaker surgery, usually they will get a dressing which is called as tegaderm, or it will be some sort of a plastic transparent dressing. If that dressing is there on the implant size, usually we require the patients to avoid direct water contact with that site. So while bathing, we should avoid direct contact of water to the dressing so that it should not get spoiled. After 7 to 8 days, when the dressing is removed and the wound is dry, that is the usual time when we allow the patients to take bath and we allow the patients to have contact with water on the implant site. Then the third thing would be there are few things that should be avoided throughout life for these patients who have got a pacemaker implanted. Important things among these is to avoid a strong electromagnetic field. Such can be found near heavy duty power lines such as a transformer. Then they should avoid a larger magnetic field that can be found near large loudspeakers. Then the third thing is avoid electromagnetic field near a welding machine. And one should be at least 3 to 4 meters away from these sites of electromagnetic radiations because they can hamper the activity of the pacemaker. Then the next thing is one should know about infection. What are the signs of infection? So if you have got a pacemaker implanted recently, if there is some redness, there is some pain, or if there is fever, or if there is some sort of discharge coming out from the implant wound, you should immediately report to your doctor that this could be one of the early signs of pacemaker pocket infection, which is one of the deadliest complications for a pacemaker surgery. Then the next thing is, whenever you visit a healthcare worker for any other reason, for any other procedure, for any other surgery, let us say dental extraction for example, you should always inform your doctor who is not from the cardiology specialty that you have got a permanent pacemaker implanted earlier, and you should carry the records for permanent pacemaker implantation. Many a times prior to surgery, the device needs to be interrogated, the device settings need to be adjusted. And another important thing is, before undergoing any form of MRI imaging, suppose one needs an MRI imaging for the brain or for any other part of spine, one should always inform the treating doctor that you have got a pacemaker implanted, and depending upon whether your pacemaker is MRI compatible or not compatible, whether we can do an MRI or not can be decided upon. And then the last thing is, one should always remember to get your device interrogated depending upon what sort of device it is. For biventricular pacemakers, that is CRT and ICDs, and dual chamber pacemakers, usually 6 monthly interrogation is needed. For single chamber pacemakers, usually once in a year interrogation is sufficient. So if you remember and follow these 6 points and always carry your records of pacemaker implantation and keep the records safe, because these are very important documents. So all the patients who have gotten pacemaker implanted can have a healthy life if you follow these 5-6 important rules. Thank you.